Hey students, this week for social studies, we're going to be talking about U.S. domestic policy. So what do we mean by domestic? That means it's happening right here in the United States. So government policies and individual welfare. This is the promotion of social and economic equality through the government policies. It can be controversial because it requires the government to distribute and redistribute income and thus compromises freedom in pursuit of equality. So almost every modern nation can be characterized as what's called a welfare state. And it's the provider and protector of individual well-being through economic and social programs. Social welfare programs are government programs that provide the minimum living standards necessary for all the citizens of that nation. So one example of this is Social Security. So Social Security is a social insurance program that provides economic assistance to persons faced with unemployment, disability, or old age. It's financed by taxes on employers and employees. And unemployment and distress caused by the Depression led to the Social Security Act of 1935. And public assistance, commonly meant by the term of welfare, is the government aid to individuals who can demonstrate a need for that aid. It's directed toward those who lack the ability or resources to provide for themselves and their family. And there are 4 categories of assistance programs under the Social Security Act. These programs have become entitlements, which means benefits to everyone who has a legal right and the government can't deny them. So the 4 categories are old age assistance for needy elderly people, aid to those who are blind, aid to needy families with dependent children, and aid to the total or permanently disabled. So let's talk about healthcare. The United States is the only major industrial nation without a universal healthcare system. The U.S. system is a patchwork of programs designed to cover different segments of the population, but not all the citizens. Government programs provide healthcare that includes Medicare, which is primarily for the elderly, Medicaid for those considered qualifying as poor, and state children's health insurance programs for children with needy families. And the cost of healthcare continues to escalate quickly, with prescription drug costs leading the way. Reforming healthcare would actually increase the current amount spent in the U.S., as well as restricting the range of procedures and providers available to patients. Medicare is a health insurance program for all people aged 65 and older, and a few individuals who are disabled or suffer from end-stage renal disease. So Part A of the Medicare program pays for care in facilities. Part B pays for the doctor's services and outpatient hospital care. Participants in Part B pay a premium of 25%, and the remaining costs are paid by the government. Medicaid is a need-based comprehensive medical and hospitalization program. The state's children's health insurance program is a health insurance program designed to provide children and families with low income access to medical care. So another aspect of U.S. domestic policy is education. Americans have traditionally believed that education could help individuals attain social and economic equality. The Elementary and Secondary Education Act of 1965 was the first time the government provided direct aid to local school districts. Education is also linked to national security and prosperity. Education reform is difficult, though, particularly on a national level, as evidenced by the passage and implementation of the No Child Left Behind Act that lasted for a few years. So when it comes to U.S. domestic policy, the question is, how can the government provide benefits in a way that's fair? The national government provides 2 types of benefits, means-tested and non-means tested. Some people argue that non-means tested benefits are not fair. Some people need benefits and others do not. Transforming some non-means tested benefits into means tested benefits has the allure during times of budget deficits. So that's just a brief overview of U.S. domestic policy. There's many other issues, and I only touched on a little bit of an introduction. But the basic question is equity and fairness, providing benefits to everyone who needs them in the United States. I'll be posting these slides as well as some practice pages for you to work on. And if you want me to post more information, just let me know and I'll do that. And if you'd like to Zoom with me on this lesson, just click on the link in Schoology.